Happy Friday, Baylor College of Medicine and friends of Baylor. What a week. What a week. We had a national championship. Congratulations to the Baylor Bears for winning the NCAA men's championship. I saw a lot of analysis about the game, and what I was surprised was no one really picked up on the most important time in the game when the momentum changed, and you'll get to see that at the end of today. The other thing, just a little bit of a teaser, I thought I'd actually spend some time discussing what you can and cannot do after you've been vaccinated. So we're actually going to give you some advice. But first, there's no accounting for stupidity. Once again, the MMWR, that's the Morbidity Mortality Weekly Report that comes out of the CDC, did a case analysis of what's going on all over the place, a local bar opening in Illinois. So, it's been a tough year, and it was time to open up the bar. And so what did they do? They pulled a Washington Avenue. Come one, come all, take your masks off, sit in the bar. They had the bar holds 100 people. They had 100 people. 4 people who attended the event had symptoms. 46 cases after that. I mean, it's amazing. 26 patrons were actually there, 3 staff, and then there were 17 secondary cases after that. And now when you think about secondary cases, that's important because remember spring break, all those kids partying on the beaches and stuff. Secondary cases take a few weeks to develop, so I don't think we're really out of the woods yet because of that. But these secondary cases, just to see how stupid you can be by doing an event like this, 3 of the cases that were secondary infections were in long-term care facilities. One elderly person is in the hospital, hopefully will not pass away from that, but it was bad. Several kids in households of these people who participated got infected, and they were on sports teams. So there's a school of 650 kids that they had to close, and they all lost their season of sports. So it's like, why was it worth taking your mask off and going to a bar so you could get people sick in a long-term care facility and close the school down and ruin a bunch of sports events for kids? Sometimes I wonder where the common sense is in the world. So what's the lesson from that? And I've been saying it the whole time. If you walk into a place and it looks like it's pre-COVID, turn around and run away as fast as you can. Do not participate in events that look like it's going like it's just beforehand. Hence the Texas Rangers baseball game. 45,000 people are going to be together. Oh, that's going to be a beauty. Anyway, that's because we're Texas and we believe in independent thought. Anyway, despite that stuff, we're doing better. The country is faring better. I know the news is a lot of negative stuff because the cases are just ticking up a little. But in general, we're doing better. Cases did go up from 50 to 65,000. The vast majority of those new cases are in small regions. It's mostly Michigan as a state and the upper Northeast and upper Midwest. California is still bad, Florida is still bad, but Michigan is really a disaster. And it's not really all that clear why. I had the opportunity to talk to the state health department there. They feel, and it might be true, that the prevalence of disease was fairly low. In other words, the number of people who had been infected before was kind of low in the state. And then they got hit by the UK variant, and they are really out of control. The good news is the pace of vaccination continues to go up. We had over 3 million doses given just a few days in a row, so that's really good. And hospitalizations are falling nationwide for the first time in a really long time. We had under 1,000 deaths, 900 deaths in a day. Now, I don't know how 900 deaths in a day became good news, but that's how bad it's been. That's good news. So if you look what's going on nationally, it's pretty interesting. It's been flat. There's been a little bit of an uptick, and it's really hard to believe that we won't see at least not a spike, but maybe a little bit of a mound increase from spring break. There were a lot of people who were on the beaches, and they all are back infecting their communities. So I have a feeling that number will continue to rise. But what's really striking is how focused it is. So Michigan is just on fire. I mean, Michigan is really bad. And the other places, of course, are the north, as I mentioned, the Northeast. Florida's still bad. And, because we don't want to be left out in Texas, Dimmitt and Karnes County are in the top 10 counties of infections per capita. in the country. So I don't know what they're doing in Dimmitt and Carnes, but they should stop doing it, whatever they're doing. But the good news is Texas is actually doing pretty good. If you look at Texas, we're sort of trailing off. We haven't seen that little mound that's the nation is seeing, and I'm hoping that we don't. You know, we've talked the last couple of weeks about the projections, and you know, it looked like we might be with a lot of cases for a while, and I think that's what's going to happen. We're going to stay at 1,000, trickle down to 900, 800. Hopefully, we'll get to the point by the end of the summer that we're very low in the community. The good news is in the Texas Medical Center data, which represents the Houston and the surrounding counties, Harris County and surrounding counties, we're doing pretty well. Finally, the R number had been up over 1 for the last 3 weeks. It's now below 1. Our testing rate is below 5%. It's been persistently below 5%. And our case rate is really kind of been under 1,000 for a while, down to 630 yesterday. So I'm pretty encouraged by that. And if you look at the average number of cases, we really have hit this plateau. And unfortunately, the projections, if we don't, because we've stopped mask wearing and some of the important physical distancing regulations, I think what we're going to do is have this persistent, high level number of cases taking place for the next several months. But we'll see. On the good news, the hospitalizations have been continually trickled down. One of our viewers, who's a physician, said all he cares about is hospitalizations. And that's true. It was a good point, but the problem is we're still admitting over 100 people to our hospitals, and we can't really go back to being normal until the case number gets down. So while that is an important parameter, there are others we need to follow as well. And on the vaccine front, we're doing pretty good. We actually have over 1,200,000 people who had at least one dose, and 600,000 who have been vaccinated, over 600,000 have been vaccinated with 2 doses. So actually, as a community, I think we've done a really, really great job at that, even though Texas as a state is lagging behind. So it's really interesting if you look at some of the CDC data. We talk about it being really focused on elderly people, but if you look at the number of symptomatic illnesses that have been there, it's really kind of, it's interesting because the vast majority of cases are in the 18 to 50-year-old category. But if you look at who's getting hospitalized over the last several years in the United States, the last year over in the United States, the people who are most often hospitalized are 65 and older. That's 46% of the admissions. But 25% of all admissions were in the 50 to 64-year-old group and the 18 to 50-year-old. And one thing I wanted to point out is that while it's a very small, 0 to 4-year-olds were only 1% of the admissions in the U.S., and in the teenage years, 5 to 17, only 2%. You look at the absolute numbers, they're not small. So I found this particularly striking. There have been 37,000 admissions in the United States in the age group from 0 to 4. So that's not nothing. That's 37,000 kids admitted in the hospital, sick enough to be admitted. If you look at the 5 to 17-year group, even though they're only 2% of the admissions, it's over 100,000 kids, teenagers. So, we tend to say, oh, it's, just the elderly. It's not. There's a lot of people who are getting sick. And it looks to me, and we'll talk about the variants, they're beginning to infect younger and younger populations in a way that's more virulent. The UK variant is dominant in the United States. It is the dominant variant in California, in Michigan, in Minnesota, Colorado. I think the Colorado introduction of the UK variant's got to come from Texas. All the people who have property there flew up there and infected all of Colorado. And, of course, the Northeast. But we have the Brazilian variant, the P1, and the B.1.351, the South African variant. They're all in the United States and pretty widely spread out. So we're learning more and more about these variants. So let's just review a little bit about them. The UK variant, we reviewed some papers the last couple of weeks. Clearly more transmissible, probably 50 to 70% more transmissible. In other words, the R number's higher. We now know that it causes more severe disease. Remember, we talked about the case fatality rate going from 0.6% to 0.9% with the UK variant. There was a paper published this week in Lancet that kind of suggested that it did not have a bigger impact on kids in terms of the disease process, but it was kind of a small study, and it really was only looking at wave 1 and wave 2, and to me it wasn't a good enough study to be able to dissect that out. The South African variant, the one that we're concerned about, most of all because of its impact on vaccines, is 50% more transmissible. We don't know if it causes more severe disease like the UK variant, but we do know that the vaccines are all less effective, and the AstraZeneca vaccine doesn't work at all for that one. The Brazilian variant, we just paper this week in the British Medical Journal, it did a lot of work on the P1 variant. It's about twice as transmissible, so it's very much more infectious, and it's infecting and affecting younger Brazilians much more than the previous strain. And if they look at the number of cases in the age group 30 to 60, it's six-fold higher number of cases now. So it's been a pretty dramatic impact on it in Brazil. And in the group that are relatively young, 18 to 45, there has been a threefold increase in the number of intensive care unit admissions. So that Brazilian variant is really a problem in Brazil. It's infecting younger people, it's more transmissible, and younger people are getting sicker. So that's one to be concerned about. That one does look like it's susceptible to the vaccines. And then there's the California variant. We don't know much about it. It looks like it's slightly more transmissible, maybe 20%, but the vaccines will be likely effective against that. Now, those are called variants of concern because they have mutations that probably impact either virulence, the ability to infect, or the transmissibility, or virulence. There's another term called variants of interest, and my sister keeps bugging me about what about the New York variant? Well, the New York is only a variant of interest. It's not a variant of concern. And until it becomes a variant of concern, Janet, I'm not interested. But here's the map of Brazil. You can see it looks like they finally are maybe peaking, and that's a good thing. But my goodness, they have had, you can't even discern spikes. They've just been going up continuously. And so Brazil is still a mess. But the good news is it looks like they may achieve herd immunity the wrong way, but they have enough people infected there that they may get it because they have so many people sick. Now, there have been some updates on the vaccines as well. We've talked a little bit about Novavax. We're one of the participants in the Novavax trial. Real interesting. It's actually we've talked about the RNA vaccines. You get the RNA in and your body makes the spike protein and then you react to it. The DNA vaccines, the body gets the DNA in, your DNA converts it to RNA, and then your body makes it. The more traditional vaccines are you actually take the spike protein, the protein itself, the peptide, and you inject that with something that stimulates the immune system. So that's the Novavax vaccine, and that's also Peter Hotez's vaccine. So the Novavax is a recombinant protein. It's made actually it's delivered into insect cells through another virus, baculovirus, and then these insect cells, are actually moth cells grown in culture, produce this protein, and that protein is mixed with nanoparticles, and this Novavax company has matrix M, that's their version of an adjuvant, and that's injected into people. We are in the middle of those phase 3 trials in the United States, and we're very eager to see the results. Cheaper, easier, stable, so a lot of positives about the Novavax vaccine. But the good news is there was just a publication that came out looking at the results in the United Kingdom, 15,000 participants in the United Kingdom, ages 18 to 64, and they got 100% protection against severe disease, and it's very much like the RNA vaccines, 96% efficacy against the original strain, 86% efficacy against the United Kingdom strain, and 50% efficacy against the South African variant. So those are really good results. So I think the Novavax vaccine coming out, it may help save Europe. Europe needs all the help they can get. So that's a good thing. Now, on the Johnson & Johnson vaccine, they are starting to add 12 to 17-year-olds, and that's just beginning now. The way they're going to do that is they're going to look at 1 and 2 doses, and the 2 doses are going to be 1, 2, and 3 months apart, and they're starting off with 16 to 17-year-olds, making sure they're okay, and then they will begin to add each age group on down. They plan on doing the study in Spain, the United Kingdom, They're already going there, and we're starting enrollment in the United States, the Netherlands, Canada, Brazil, and Argentina. So that's going to be, we should actually get a lot of information fairly quickly on that. They're also in discussions with the authorities about trying to look in pregnant women and young children fairly soon. So that's all very good. More data that's coming out on the Moderna vaccine. We now have data that the antibodies levels stay up at least 6 months. So they've done a really nice study looking at several, like 30, 40 participants, and followed them over time to see their antibody levels. And they're up to 6 months now, and they still have very high antibody levels, so that's very good. AstraZeneca, it continues to, their information continues to show up that it has side effects. There were 15 deaths that were reported in Europe. It's a strange combination because you get a low platelet count, and yet you have clotting. Now, platelets are what causes clots to happen, and yet you have low platelet counts with clotting and some bleeding. So it's a little bit confusing. There's some German physicians who have suggested that it's a little bit like when you get heparin, a drug that induces an antibody to platelets. You get this sort of paradoxical thing, and that's what they think it is. It's not all that clear. But if you step back and be rational about it for a second, the estimate of this complication is 1 in 25,000 in Norway. There was 1 in 87,000 in Germany. Only happened in a few younger folks. There have been 11 million vaccines given in the United Kingdom, and there have been 0 reports of this complication. So when you start thinking about it, you got a 1% chance of dying if you get infected, and you got a 1 in 50,000 chance of having a complication. It's like, I think the regulatory agencies will continue to push it because that's the main vaccine that they have in Europe. But Canada and Germany, Iceland, Sweden, Finland, and France are now all recommending that you don't give the vaccine in younger people because they're worried about this clotting issue. I personally think they're overreacting to it, but this is what happens. With vaccines or with anything, with any drug, you occasionally rarely get a complication. This is not a high rate of complication, particularly considering the severity of the illness. So we'll see. Luckily in the U.S., we don't have to worry about it. These are mostly, we have Pfizer and Moderna, and you can see the number of J&J vaccines beginning to increase. So we're actually doing pretty well in this country, and I guess we guessed better than others. We actually have good vaccines that are effective and have been very safe. Over 300 million doses, no problem. So I'm good with that. So the biggest question I get all the time, my sister included, and her friends, I've been vaccinated. What can I do? So let's start off with the obvious. There are 2 reasons why you need to be really concerned and why we're not just throwing our masks off and celebrating. One is we have a person here that works here who's fully vaccinated, went to visit a sick relative, and got infected, and is actually pretty sick. Not hospitalized, but pretty sick. So there's a real good example of someone who has been vaccinated and still got exposed, because it's not 100%. It's 90%, 95%. So 1 in 10, have a chance of getting infected. Now, it has prevented severe hospitalizations and death, but you still can get pretty sick. And the second is a real sad story that a friend of mine whose brother got married, and the best man got infected with COVID, not vaccinated, but 36 years old, and just passed away. It was on ECMO, which is a way to oxygenate blood for months, waiting for a lung transplant. So we're in the middle of a pandemic with a really bad disease. And people go, well, it's just old people. Well, no, the 36-year-old died, and somebody's been vaccinated is sick. So we still have to be careful. We still need to be careful. And my sister said, well, how do you explain it, to her folks? And I was going, well, we're on the edge of the forest, but we're not out of the woods. We see the light at the end of the tunnel, but we're still in the tunnel. The embers are still smoldering. The fire's not out. The plane hasn't landed. We can't declare. We haven't gotten through the finish line. So we're not there yet, and we just need to be patient and behave reasonably, common sense for the next few months. So, what is a vaccinated person? Well, 1 dose of Johnson & Johnson or 2 doses of Moderna and Pfizer, and you have to be 2 weeks after that. That is what means vaccinated. Not I had my first dose, not I'm 1 day after my second dose. It's 2 weeks after your second dose or 2 weeks after your 1 dose of Johnson & Johnson. So what can you do? Well, the CDC is very conservative, and they need to be, and I understand that. But if you have a group of adults, they say only 2 households. If you have 3 couples that have all been vaccinated, and you want to have dinner with them, 8 people, and you've all been vaccinated, you can have dinner together. Take your mask off, have dinner. That's just common sense. The chances of you being a carrier is extremely low, and the chances that you'll infect somebody are extremely low. So I think that makes sense. If you are around unvaccinated people, don't go into households where there are people at risk, because there's still evidence that 20% of the people vaccinated could carry virus. So you don't want to be around an old person, or you don't want to show up with a patient who's got cancer, or a transplant person, or somebody who hasn't been able to get vaccinated for illness. So those are the things that you shouldn't do. But if you go to your family's house and they have some kids that haven't been vaccinated and you've been vaccinated, that's okay. That makes perfect sense. You can travel. Wear a mask, but you can travel domestically. And right now with international, you can leave the country. Now, to get back in the country, they don't want you to bring in a variant. Even if you are vaccinated, you might be carrying something. So you have to get tested before you come back, just to make sure that you're not carrying it. Now, what should you not do? Well, don't go to a bar in Illinois with 100 people and take off your mask and celebrate. Are you going to go to who's going to the Rangers game? I just don't get it. 45,000 people packed together. You think there'll be somebody who wasn't vaccinated and sick there? I don't know. So, in situations that are in public with lots of people and you can't do social distancing or physical distancing, wear your mask. When you're out, wear your mask. It just makes sense for you to do that. If you're with people who are at risk, wear your mask. And I still would avoid large gatherings. I think, it doesn't make any sense to aggregate a bunch of people at this point until we get the vaccination level up to the point where we actually have achieved herd immunity. And if you'll recall, when I say herd immunity, people will still get sick. Herd immunity is 65-70% of the population. 30% is still susceptible, so they will still get sick. So anyway, I just want to say at the end, once again, congratulations to the Baylor Bears. And I think you'll really be interested in seeing this insightful clip on what really happened to turn the tide and have Baylor win. So have a great weekend, and I will see you next week.